thinking about health span is thinking about even to the quality and how about we feel, because of course the quality of the life is our mental and brain setting is. And so I'm really happy to start a new session, and I thank Lundbeck to support this discussion, even because Lundbeck was the first company starting to talk about brain health, starting to develop a culture about brain health. And so I'm proud to invite here the Senior Vice President of Lundbeck, Thomas Klee, to introduce this session. Thank you. Oh, a microphone? Can we have a microphone, please? Perfect. Thank you.
Thank you very much. Is it on?
Oh, okay, right.
Thank you very much, and also for giving us in Lundbeck the chance here to present Lundbeck's brain health commitment. For those of you who doesn't know Lundbeck, Lundbeck is a mid-sized pharma company. We have our headquarters based in Denmark with Danish tradition, but we are present in more than 50 countries. We have a quite particular ownership. We are 70% of our shares is owned by the Lundbeck Foundation, and the particularity about the foundation is that it's donating around 500 million Danish kroner, and for those of you who doesn't know the currency of the Danish kroner, it's around 70 million euro on an annual basis to public research within brain research. We touched the life of 7 million people, more than 7 million people around the world with the treatments that has come through Lundbeck's pipelines over the years. And we invest around 20%, actually on top of 20%, in R&D, research development, because we believe that's the fundamental way to improve brain health over time. We have a long history, as you also pointed out, thank you, more than 100 years, and the past 75 years of those we have been focusing entirely on neuroscience as a company. We focus primarily on psychiatry and neurology, and that is where our science base lies. Over the past years, we have moved more into what we call neurospecialty, in particular migraine. And our pipeline and the science behind is taking us now into neuro-rare, where the need for new treatments or need for treatments in general are enormous. So that's a great paved way also from our background into where science is taking us. That mission of ours, improving brain health, is underpinned, as I said, by our ownership. Besides donating a lot of money into public research, we also have the biggest brain prize, or Lundbeck Foundation has the biggest brain prize, which is given to top researchers around the world who investigate their life into discovering new technologies, new methodologies, new pathways in this particular area. The good thing about having a long-term owner is that it allows us to focus on long-term, because when you are in brain research, it takes a long time and you need to invest a lot of time, money and prioritization within this field. So therefore it's good to have an owner who understands that and are behind us to grow organically. We are operating in a growing, fortunately, neuroscience market. As one of the speakers said before, you saw an aging population also means that there is a higher life expectancy in the general population. That, of course, also means that we will see more mental health disorders. 1 out of 8 already are suffering from mental health disorders. We know that brain disorders in general touches the life directly or indirectly half the population of the world. And then neurological disorders are the leading cause of disability worldwide, and actually the second largest leading cause for death. Fortunately, the neuroscience market is growing enormously, and now the neuroscience is on top 3 of all new products being developed and approved both in the US and fortunately also here in Europe. And that is based on the rapidly evolving science and technologies within this field. That also brings a lot of new modalities, new treatments into this space, which is at the end of the day ultimately serving the needs of patients. With a growing burden of brain diseases, we know that the life expectancy for those particular people suffering from these disorders can be 10 to 20 years less than the general population. As I said before, it touches almost half, directly or indirectly, of the world population. So 3 billion people are touched by these disorders. From a socio-economic factor, it's clear that 10% of the world's GDP is or that there's a disorder cost which is around 10% of the world's GDP. And just depression and anxiety alone is estimated to be $1 trillion. This is also for us as a company entirely focused on these disease areas, navigating in the most challenging organ in terms of research is an enormous task. And of course, the brain is enormously complex, but also we are relying on actually outdated molecular targets for treatments, and we do not yet, as in other disease areas, have clear biomarkers that will lead the way. Clinical trials, they also take much longer time in this area, up to 10 to 15 years, which is significantly higher in many other areas. And only, unfortunately, 10% of these molecules come out on the other side that we can offer as treatments. The cost for bringing a treatment from molecule to patient is around €1 billion, so it's also a costly affair. This is also a reason why we as a company need to be super optimized across the value chain, bringing in new technologies such as AI to optimize each step of the way so we can ensure to bring down that time from molecule to patient. We are a science-driven organization. We have people, a good mix of people from academia and people from industry that comes together every day on work to really fulfill our mission to improve brain health. We work together with institutions, academia around the world because we know if we need to do it well, we need to bring in the latest technologies, the latest insight from the research into our way of doing business. The way we think about research is really threefold. Let the biology speak, let the molecule speak, and let the patient speak. Let the biology speak is about choosing and focusing on the right biological areas, where we also know that the different modalities, molecular modalities, there is a fit between biology and modality. The other one, let the molecule speak, is really threefold. We have to ensure that there's a clear indication. We have to ensure that there's a known and understood pathway. And then we need to have also a biomarker in order to be able to de-risk projects early or actually to accelerate projects early through the pipeline. Let the patient speak is an integral part of how we work. We invite patients in to give input to the way we do clinical trials, to the way we do medical education around the world. And these three items here, they go hand in hand in our approach to science or to research. Migraine is a very good example of what we are doing. It's an area that touches a large proportion of a population. And actually, it's a huge socioeconomic burden, as you can read from the numbers up here. However, despite this prevalence, there is a huge element of stigmatization and misunderstanding around the disease. And just until recently, the treatment of migraine was only in acute pain medications. But science has led us to much improved understanding, in particular around the pathways and the reasoning for migraine. And in the recent years also led to new medications that are actually preventive in their form. One of the examples of our collaboration with public partners, because we know fully we cannot do this alone, we need collaboration with everyone involved in this space. An example I brought here is a study, a real-world data study that we are doing with the quite famous Danish Center for Headache and Migraine. We have engaged with them to try to understand how can we improve treatments for patients and where are they on the pathway? How do they express during their time with migraine attack and also in the time without migraine attack? How do they live their lives? So therefore we have made this study together with Danish Headache Center of using an app where they tell us their story through 3 months. And by that, hopefully, we'll get much better insight of 100,000 Danes in a real-world study on their headaches and how their treatment pathway looks like. And this study will be published in 2025. We work with more than 80 different patient organizations around the world. We have what we call One Voice Summit on a yearly basis, where we invite patient organizations to talk about what it is to be a patient with a brain disorder. We, as a company, sit and listen and try to understand what it actually means to suffer from some of these disorders. Because I think fundamentally and essentially, the mission that we have to improve lives for people who suffer from brain disorders starts and ends with listening to the patient. Thank you for your attention, and I wish you a very good day also.
Thank you, Mr. Klee. Please stay with us. It was very interesting, even because you explained us that today we need a systemic approach. We understand in this century that the mental situation is connected with the body one, and if we want to think about health, we have even to think about prevention. So we need really to develop a systemic approach. And there is a very interesting systematic approach which was developed in Singapore to have a strategic view even to promote the longevity. And we are really pleased to have with us Professor John Wong, Isabel Chan Professor in Medical Sciences, Executive Director, Center for Population Health, National University of Singapore, and Senior. Welcome, Mr. Wong. Thank you. And because Professor Wong is one of the key persons who designed a very strategic approach to develop a new vision for longevity, even especially in the cities. Because in all the changes that we are thinking about, we have to think that in 2050, the 70% of the global population will be in the cities. And we think even about to redesign the cities to support lifespan and health span.
Well, thank you very much. As I spoke yesterday, and I wanted to thank the organizers for inviting me, and I would particularly like to thank and remember Viviana Kassam, because I met her multiple times on Zoom, and I was really looking forward to meeting her in person. And so, well, this is dedicated to her. So I'm going to break my talk into three sections. Firstly, talking about this concept of that we can really try and approximate healthy life expectancy to life expectancy. I fully agree with Professor Crimmins' talk. I don't think that we will be able to increase life expectancy too much. We heard from Professor Ramakrishnan this morning. But I think we can reduce morbidity. I'd like to share with you some of Singapore's national strategies and something called the Health District at Queenstown. So you've seen multiple charts of this, of life expectancy, as well as health-adjusted life expectancy. And the question is, how can we address this gap? And I think it's very important, and I'll touch a few slides which I presented yesterday, but I think it's worth reflecting again on the definition of health. And that it's really a combination of physical, mental, and social well-being. I think we spend a lot of time addressing physical well-being. I think we are spending more, thankfully, on mental well-being. I don't think we're spending enough on social well-being. And I am a practicing doctor. My specialty is medical oncology, but I think we need to address all three. The US National Academy of Medicine defined healthy longevity as the years in which good health approximate the biological lifespan with physical, cognitive, and social functioning. And I think that this is very important to remember this. And it's preservation of health for all into older ages. So 3 concepts yesterday that I mentioned. Firstly, that health is the outcome of multiple determinants. Health is the outcome of a complex system. It really requires a whole of society and whole of government approach, and that we need to have investments across the life course and at every age and stage of life. And I think these 3 concepts are so important, but because they're so hard to address, that's one reason why we have the challenges we have today. So the evidence is out there. WHO's Decade for Healthy Aging, as well as the US National Academy of Medicine Global Consensus Report. My conflict of interest is that I did co-chair the US National Academy of Medicine report. But these are free, download them, and I think that it's worth studying the evidence. So what is Singapore trying to do? Because Singapore is rapidly undergoing demographic change. Well, the first is that Singapore does have a publicly declared social compact. You can type in the words Singapore Social Compact, and you will be brought to the website of the Ministry of Social and Family Development. And there are 6 areas that Singapore wants to strive for equity: education, employment, healthcare, housing, retirement, and social and community assistance for those who are vulnerable. And again, I think that the public educational system, the public housing, the public healthcare system are strong, and I think this is one reason why Singapore has been able to actually progress over the last 50 years. These are the large national strategies. There are billions of euros being invested. These are white papers, policy papers, Action Plan for Successful Aging, which was refreshed in 2023, Healthier SG for Healthier Singapore, and Age Well Singapore. These are all national policies. So what we are trying to do is we are trying to take national policies and we're trying to take global recommendations and implement this at the township level. So we are taking one township, population close to 100, or just over 100,000. It's already a super-aged community, so more than 21% are over 65. This is reflective. The whole of Singapore is going to look like this in the next 2 to 4 years. And just under 80%, 80, live in public housing. So this reflects the socio-economic profile of Singapore. And we said, can we take a whole of society, real-world, location-based platform to develop programs which are not only efficacious, but they are scalable and they are sustainable. And we want to do this through co-creation with the residents. 4 goals. We want to increase healthy longevity. We want to enable purposeful longevity. We want to promote intergenerational bonding. And we want to support a community for all ages so that people can age in place and not have to go to nursing homes. We work very closely with political office holders. It is co-led by, it's co-led by the National University Health System and the National University of Singapore with the Public Housing and Development Board, which houses 80% of Singapore's resident population. We have the Ministry of Health, we have the Ministry of National Development, we have the Ministry of Community, Culture and Youth, we have the Ministry of Social and Family Development, we have the Ministry of Trade, and we have one of the biggest foundations representing the social sector. So really trying to take a whole of society, whole of government approach. And we are working across these work streams. We have a pillar in preventive health and care delivery, purposeful longevity, planning and design of the built environment, technology, very important evaluation. We are doing this through co-design and co-production with residents and stakeholders. We have a whole work stream looking at communication and engagement. It's very important to be data-driven, and then we're harnessing the best of behavioral and implementation science. So just briefly, the preventive health and care delivery, we're trying to take a life course approach ranging from pregnancy through early childhood, adolescence, young adulthood, middle and older age. We're trying to improve exercise, sleep, and diet amongst the residents. We are looking at implementing all the level 1 evidence in terms of screening and vaccinations. We are looking at chronic disease management as close to the patient's home as possible, so that we're trying to manage chronic disease in the community rather than through hospitals, care at home, and then aging in place. In terms of purposeful longevity, we're developing these hubs. They're called Ibasho hubs. You can key in Ibasho, and it's a concept of really harnessing the wisdom of every demographic group, older people, younger people, and a big push for intergenerational engagement. We are really seeing how we can allow people to remain in work, whether it's full-time, part-time, or this concept of micro-jobs, and very importantly, working on how to enable lifelong learning and reskilling. The third area is in planning and design of the built environment, developing public housing for families as people age and making the apartments as age-friendly as possible. We want to embed sports science in the community. We want to develop wellness landscapes, enhancing dementia friendliness in the neighborhood, and social and wellness hubs. We are harnessing technology. We're asking technology to do 4 things. Can technology keep people independent? Can it nudge people to remain healthy? Can we identify high-risk residents? And can we enable care delivery into community and homes? So we're working with companies to develop camera-based vital signs monitoring. We are working with the ability to screen for eye conditions in the patient's home. We're detecting fall detection systems. And we're working, looking at the use of artificial intelligence to develop what we call ambient intelligence to identify high-risk subpopulations. In terms of communications and engagement, we want to develop the narrative to really tell people that we can remain robust well into older age, but we have to invest over the life course in all of these areas. We want people to rethink how we live, how we learn, how we work, how we play, across the whole lifespan. And then very importantly, that older people are a huge source of untapped human, social, and economic capital. And if we could harness this, it can really lead to the benefit of the whole society. So we're developing and testing these key messages. We're identifying different communication channels for different age groups, for different educational levels, and then the campaigns will be starting this year. So this session is on brain health. So we have been looking at several scores, and I just show you one brain care score looking at multiple domains. This is developed by at the McCain Brain Care Score at the Massachusetts General Hospital. And we're trying to see whether conveying to residents that there are multiple aspects of brain health that they can work on, and how do we do this at scale? So finally, how are we evaluating this? So we're evaluating all our efforts across 5 domains. Firstly, the domain of productivity and engagement, well-being, security, and that's physical, financial, as well as food security, cohesion, and equity. We are currently going to be tracking 43 indicators, and this is taken from the Aging Society Index. It was just recently updated in the December 2024 Nature Aging. We have an international advisory panel with experts from the United States, United Kingdom, Japan, working very closely with us. And we finally want to reframe this whole challenge of demographic change. As I mentioned yesterday, that long-lived populations are not the problem. The problem is that we haven't removed the barriers to allow long-lived populations to remain healthy and robust. Because if we do, we can really unleash a resource that has never existed before. I mentioned yesterday that it's akin to what happened after the Second World War when women entered the workforce. So if we have, you can see that we've gone from demographic pyramids to basically rectangles. If we had subpopulations of robust, healthy, younger populations and healthy and robust older populations, that combination, the synergy created, could really unleash huge amounts of human, social, and economic capital. So thank you very much. Thank you.
Thank you, Mr. Wong. Thank you. Thank you. An amazing example. And I'd love to invite 2 top Italian scientists to join here with us, Monica Di Luca and Alessandro Padovani, to develop the discussion about brain health. But Mr. Klee, one question, because... Ciao, Monica. Benvenuta. Ciao, Alessandro. For your work, you know very well many regions around the world. And Singapore brings us a systemic approach. But are we ready in Europe, from your point of view, to take this lesson?
I think it's a key lesson that Europe needs to take around the approach to health, because despite the fact that we are a European Union, we do it very differently across Europe. I think recent events could perhaps make us in Europe focus in a more unanimous way on health and also how we can approach how we can make a different approach to health and longevity, because I think Europe has a key interest in being world champions in this.
Thank you. And talking about a common approach in Europe, I'm really glad to have here with us Monica Di Luca. Monica is actually the Vice Rector for Research for the University of Milan, Professor of Pharmacology, President of the Neuroscience Society of Italy, President elect of the Pharmacological Society, but she was even the President of the European Brain Council and the European Federation Neuroscience Society. And so she worked a lot in Europe to get a common vision, to break the silos. So, Professor De Luca, how we can work today to break those silos for brain health?
Thank you. Thank you very much. First of all, let me say that's a real great pleasure to be here, because I think that is a quality time to share some ideas and thoughts on some aspect that I still consider vital for the future of our society, that is brain research as a whole, and particularly the brain research which is related to brain health promotion, which is a key aspect now. And of course, the topic now comes to be the brain, which is, of course, the center, the command center of our life, but it's also the most complex organ of our body. And this complexity makes this organ the least understood organ of our body. And for this reason, for this complexity, for this lack of understanding, we are still struggling to find adequate cure for most of the brain diseases. And we know, we just heard it from Lundbeck. And we need all common efforts, all the sectors together to really to win this battle and to try to do something good and profitable for the benefit of our society. So this is what I consider a major health challenge for the next decade. This is all of it. And as a scientific community, I have to say that we know that we are confronted to this major challenge every day. And this is also a growing societal challenge. We heard the numbers also from previous speakers. At the global level, these numbers are huge, but even if we look solely into Europe, and we look at the number of European Brain Council, and we have not only me, but also the Vice President of European Brain Council here today, which is Claudio Bassetti, that can speak loud about that. But if we look at the European number only, we know that these numbers are incredible. We have 179 million people affected in Europe, only in Europe. That is 1 citizen out of 3 that can experience a brain disorder along the life, and this costs a lot to the society. The cost has been estimated already 10 years ago to be 800 billion euros. So this every year, something that is going to be unaffordable in the future for each society. So this number really showcases the immensity of the problem that we are facing, and of course are set to grow. We know that we live longer, and together with more years of life comes more diseases that we need to prevent. So it is clear that these numbers calls for action, action that has to be done together, needs innovation, needs intense research, absolutely and urgently, and need the attention of the policymaker. And I think really that given the immensity of the task we are discussing here today, joint efforts through large cooperation, large collaboration across borders and across disciplines, it's a must. We can't avoid it. So I think it's important to discuss not only on the importance of brain research per se, which is of course a prerequisite for brain health, but also on how building bridges and breaking down silos across research disciplines and sectors, and I would like to emphasize across sectors, can really be transformer for this field. And also maybe we can discuss on how in Europe we get organized already 20 years ago, generating a council that really tried to break these silos already at the table, merging all major stakeholders that had an interest in the brain to achieve common goals, open a dialogue with policymakers, attract the attention of governments and policymakers to discuss this major health challenge. And why it's so important today? Because I really believe that we cannot talk about longevity without speaking about brain health. This is tightly intermingled. There is no health without brain health. This is the motto of European Brain Council that I keep on repeating, Claudia. So maybe we can discuss why this is still a challenge after so many important results in research and so important achievement. But of course, this is linked to the complexity of the system that we are studying, that hamper our capacity of understanding and cure, but we are almost there. We are managing very far. But when it comes to a complete understanding of the brain, I really would like to stress the fact that no single discipline can work in isolation. The complexity demands that we build bridges between scientists, not only clinicians, industry experts, regulators, so accessibility to drug and treatments, policymakers, and importantly, the civil society as a whole and the patients themselves. We need to work all together. So imagine each of these groups as a piece of a puzzle. So alone, of course, gives a limited insight on the figure, but when you put everything together, then it's impressive, clear picture of the whole. So really, by breaking down barriers, we open channels for knowledge exchange, innovative ideas, and ultimately faster translation of discovery into treatments. So we know this very well as scientists. I just would like to mention a few numbers, if you may allow me. I would like to mention a survey or a report that has been published a few years ago related to the collaboration of these scientific products. And if you look to the area of neuroscience or brain research in general, more than 52% of the publications, so the scientific output, the products and the results of the research, is collaborative. And when I say collaborative, it's not only international, so geographically, but it's also collaborative in terms of different disciplines. And the disciplines are very disparate. I mean, we have mathematics coming into, we have informatics coming into the biological area, in and out to help. And this is really going out of the silos, for sure. And also, I have to mention that the total amount of the scientific results worldwide, 60% is in neuroscience. That is to say that when we break down the silos, we really unlock an extraordinary potential. So building bridges means fostering a dialogue that accelerates progress from the lab to the patient and to the society. And this is very clear. But we need to know that to be effective and to really promote brain health is not only a matter of discussing quality of science, talent, excellence of research. We need to address the policymaker. We need to promote and to speak as one voice to the policymaker. And this is exactly what we did in Europe, generating already 20 years ago the European Brain Council that is really putting together everybody, all the single speakers, just to speak as one voice, as a single interlocutor to the policymaker. And this is extraordinary importance because you need to align the strategic agendas also of the government, of the politicians, to really address strategies, as we heard in Singapore, for example, to really address strategies that can tackle this problem. So I have to say that our idea is to, already 20 years ago, but you will hear from the National Brain Councils very soon today, the idea was to convince the governmental, the politicians at European level, but also downstream capillary to the member state to prioritize brain research in their agenda. It's not only brain research, we wanted to prioritize brain health. This is the conceptual frame in which we want to move. Because we really think that the socioeconomic impact of the brain disorders demand an appropriate response by policymakers in the same way for other major diseases like cancer. We need to be treated at the same way. We need to be considered a challenge. EBC, the European Brain Council, has been extremely successful. We reach the attention at the political area. We manage to align the political agendas of member states, for example, in research, in goal-oriented topics. But of course, now we want to be even more ambitious. And we try to convince to have a very general partnership all over Europe on brain health. And this partnership is now a reality, I have to say. It's very important. It has been incorporated in the new structure of funding of the European Commission and European Parliament, and will be not only research, but really a policy approach with impact on the need for preclinical research, but also clinical research, healthcare, and in the area of brain health in general. And there would be a particular aspect on education as well, because this is, as you said, an extremely important aspect. It will foster close synergies among national and regional programs, bring together all aspects of stakeholders to work together common goals, with the vision of improving brain health for all, developing scientific knowledge as a ground to promote brain health throughout lifetime in all different aspects. To reach this goal took a little bit of time, 20 years, Claudio, maybe. Dedication, but now we are there, and really required a shift in mindset. From isolated research effort to a collective, unified endeavor that embraces innovation in the broadest sense, from novel scientific approaches to groundbreaking policy recommendation. So it's really inclusive of all the concept. It's not only research. And we have an aspect on innovation. We need to accelerate innovation in this field and to be able to capitalize on the excellent results of basic science to transfer them into practical aspect for the benefit of the society. And we need also to encourage biotech, other companies. We know that Lundbeck had never left the field, and for that requires a lot of respect, but we know that many companies left the field of neuroscience. So we need really to convince people to re-enter this field and to work together. So cross-sectoral interaction, training scientists to communicate effectively with investors and regulators, which is absolutely a step forward, dismantling the barriers that for a long time had really blocked or stopped or hampered innovation in our field. So in conclusion, if I may say, achieving breakthrough in brain research is not only about finding a scientific talent or excellence, but it's about uniting our diverse strengths and our perspective and working all together. Thank you very much.
Thank you, Professor De Luca. But Professor De Luca, one more quick question. First one, how we can explain the return on investment in brain research?
Wow, this is a very important question, and we tried to tackle it in the past in the European Brain Council. We had some paper published in the literature in which we asked to payers, are you really want to invest here? Do you want to pay for this? Because if we don't do any, let's take an example. What is happening if we do not invest in dementia, for example, okay? For just a general thing. We know that a dementia patient costs per year 22,000 euros per year. So if we don't do anything, this is going to increase. We increase the number and we increase, of course, the costs, which are direct costs and indirect costs for the society. So it's a very complex element. So it's not only the sanitary service, but also the family and all the indirect costs. But if we invest, how much we can change this number? So there was a study of European Brain Council showing that you can basically halve the cost if you find a drug that is not curing, but is delaying the progression of the disease by 5 years. This is the way you convince the policymakers.
Thank you. And one more quick question, because I know you're working here a lot to move Milan University into the Milan Innovation District. And how do you expect this strong change will help the brain research?
I think that this
because
is going to be...
there is a strong contamination, a strong contamination in the Milan Innovation District.
Absolutely, this is the point. What we want to achieve there is a real a role model of interaction between the different sectors. We have their research center, we have their university and students, so we can bring education into the campus, but we also have private sectors, we have biotech, we have spin-offs, so it's really a sort of an ecosystem that will certainly boost the life science research in Milano.
Thank you, Professor De Luca. Very, very interesting. Again, but we have even the pleasure to have with us Professor Padovani, who is the director of the Institute of Neurology, director of the Institute of Clinical Neurology, and of the University Department of Clinical and Experimental Sciences of the University of Brescia. and he's even the president of the Italian Neurology Society. And Professor Di Luca highlights the need for action. And we all know, Professor Padovani, that you're working a lot. You present last year with the Ministry of Health a manifesto, One Brain. You work even to support a group in the parliament to talk about One Brain. How we can bring this action become real for Italy?
Well, first of all, thank you for the invitation. I would thank Brain Circle and the scientific committee for having invited me, and obviously Lundbeck for having made this possible. I'm going to talk on behalf of the Italian Society of Neurology first, and on what we have called so far the Alliance on the Italian Brain Health Strategy. We, since last year, have tried to call scientific societies and foundations and association of caregivers and patients, and we have termed our action One Brain, One Health, because one brain means that we, as Monica said, we are all working together. Brain is a unitary system, and there is no monopoly from any scientific disciplines on one side, and then I will go into details later. One Health, because we are strictly related with the environment, life sciences in a broader sense, and brain is strictly connected to the environmental and all the other diseases. So thank you first. What can we do? This is a nice question, and what we have done so far with Monica and Matilde Leonardi that I saw in the, she's there, okay, great. Let me start from far, because I think we have to point and focus to certain aspects. If you think about brain health, you have to, in some way, reflect about some miracles. One of the miracles is life. I'm talking in the broadest sense of what life is, what the sense, the significance of life. Life is a miracle, and we don't know what life actually is and why all of us, all the animals, all the plants are sharing the same laws and rules. There are a lot of things we have to discover, but life is in the universe something unexpected and in some way a magic emergence property. When I talk about life, I have to talk about cells. But when I talk about cells, I have to think about brain. Brain is such a complex organism. And a lot of life species do not have a brain, but the brain at a certain point has become a sort of emerging competitive advantage or achievement. But as life is vulnerable, brain is even more vulnerable. And in top of the brain, we have to talk about mind and consciousness. Mind and consciousness has been a recent achievement by organisms, and mind and brain, mind and consciousness belong to the humans in a strict way. But even mind and consciousness are very vulnerable. Actually, I would say is the most vulnerable property of a brain, and the brain is the most vulnerable property of life. So we have these three strictly connected aspects that are miracles. At the same time they share a sort of vulnerability, but we have to look at them and say, wow, this three aspects has made it possible to increase our longevity. And how was this possible? This was possible because the power of science. So science is the emerging property of a mind and of consciousness. And without a mind and consciousness, you cannot reach such a great achievement that is longevity. Longevity on that side is definitely posing a lot of challenges. Dr. Wong has already underlined some of them. our economical challenges, our social challenges, our scientific challenges. What is longevity? In our experience, why should we age? What is aging in the ultimate analysis? Why humans has to age? On the other side, we know that aging is the condition through which we accumulate frailty. So we are vulnerable on one side, but when we age, we become even more vulnerable because we become frail. And frailty is the, let's say, the emerging property of longevity. And without frailty, we would probably be happy to be very aged. But if age means also frailty, then we have to take into consideration what is the rules, what are the laws, why do we frail along our increased lifespan. So on the other side, we have to think about longevity as a miracle, but we need to work on healthy lifespan. So we have to increase our ability to maintain our health. And brain health is even more difficult because there are a lot of diseases that actually are related to aging. I'm not talking about only Alzheimer's disease or Parkinson's disease or ALS, but actually there are a lot of things that happen in our brain that decrease our power, decrease our consciousness, decrease our mind. So brain health and mental health are becoming strictly connected, related. Can we separate mental health in an aging society from brain health? So I think this is one of the things Monica, me, and Matilde has discussed many times, and we think that brain health, mental health are our focus, and we have to work. So I call this the harm of evolutionary success. Longevity is a success, but is posing so many challenges and harmful situation for benefit from longevity. So when we talk about aging, so aging, as I said, is posing a lot of weight on our societies. Monica has underlined the role of policymakers. We have to talk to policymakers because we have the feeling that they didn't realize actually what is going on in our society. We are looking at a demographic transition. Italy, and I would say Brescia, for example, 28% of elderly people. Italy is probably in the next 10 years even increasing the number of people older than 65. And I will be older than 65 in the next 10 years, actually next year. But in the next 10 years, I will belong to this successful aged group. So there is a lot of things we have to do. And I think Singapore is probably showing how a country, a region should work on. But what are what can we do as a physician, as a scientist? Well, we have to identify, for example, what are the genetic factors that allow some of us to reach 100 years of aging without any disease. So there are some centenarians that do not develop frailty. They're not really frail, and they maintain a good condition. So recently, Nature Medicine published an interesting data on the 6 magic gene factors that in some way are related to an increased lifespan. But I think the genetic technology will allow us to modify the genetic background of humans and allow them to increase lifespan. Even some drugs are increasing lifespan, like antidiabetics. We know that antidiabetics are working, and diabetes is one of the major risk factors for even brain health and mental health. But I have the feeling that GLP-1 receptor antagonists will eventually be a sort of a way for increasing our healthy aging. But besides this, there are a lot of things we have to work on. We have to preserve brain health by modifying lifestyles and reducing risk factors. And in the brain score that Dr. Wong has presented, there are some factors, some risk factors we know strongly impair our health, somatic health, but ultimately also brain health. So we have to work on lifestyles, and still I think we are not aware about how powerful are lifestyles in modifying our mental health, I would say, and brain health. On the other side, as the Ministry of Health has underlined, One Health means that brain health is connected to body health and somatic health, and mental health is related to, let's say, a social health. So a good society is the best way to preserve and so we prevent mental health disorders, and there are a lot of evidence that somatic health needs to be under our attention in order to prevent a lot of brain health diseases. So brain health and mental health are probably the two faces of the same coin. They're strictly related, and eventually they recognize the same risk factors and the same prevention strategies. So from here, by going through the World Health Organization and the European Brain Health Mission, and Claudio Bassetti will eventually reinforce the mission that a lot of countries has put on brain health strategies. With Monica, with Matilde, and with many others, we decided to push, to have a strategy, a national brain health strategy, and starting talking with the politics, the policymakers, and say, well, we are here, we are ready. We have a great community of scientists, basic science and clinical scientists, and we have also a lot of association with us, and we have a lot of scientific association, and we have a lot of federation and foundation. So we are ready for. And I'm very proud of what we did in this last year. We went to the G7 in Ancona, talking about brain health. We established some political intergroup, as you said, Ludovico, and we are starting to develop a sort of a national plan together with the Ministry of Health. It takes time, and we are. Well, we have some time, but Brain Circle on one side, and even Prada Foundation on the other, are all together talking with the same voices. We have to work on a national plan, and I'm talking here in Milano, Lombardia region, because this region has to do the master plan, because we are at risk because of the pollution, and think we have a lot to do in terms of cleaning our environment. So this is my last slide. What I'm saying, we under the auspices of the Italian Society of Neurology, we term our challenge One Brain, One Health, that is take care of your brain and protect your future. But I think we have to extend this auspice, this wish, talking to the people as we do now, and saying that we need to take care and preserve all the brains of our society, all the brains that are here, because this is the only way I think we can protect life, as I said before, and protect our future as a mankind. So this is my last slide.
Thank you very much, Professor Padovani. And one more question, because we can say that you were very brave in building some bridges, the one that Professor Di Luca mentioned before, because, for example, you work on one brain, bridging neurology and psychiatry. But how is the readiness from a cultural perspective, cultural point of view, in building these bridges and, for example, in bringing together neurologists and psychiatrists?
Well, nothing is easy. We don't like easy things. We are bridging let's say, young neuropsychiatrists with the Italian Society of Geriatricians. We are bridging basic science, neuroscience with neurology. And, you know, psychiatrists are very jealous about mental health, and they think that mental health belongs to somebody like them. But I think that mental health is a sort of an inevitable condition that affects all people with brain diseases. So there is no border there. We have to bridge the border, and I think this is the way we found solution. And this enterprise and this challenge does not belong to any discipline. I think all together we can do it, but if we separate and we get jealous about our, you know, our comfort zone, we are not making benefit from I would say the mankind and the society. So together we can work for the society, and I think the example of Dr. Wong is pretty clear. I think all of us has to make you know, its part, its responsibility, but together I think the effort will be successful.
Yeah, and it was amazing 3 weeks ago in the parliament to hear one of the most well-known psychiatrists in Italy using the word that I think you used 1.5 years ago. So probably seeding helped to develop this vision, this culture. And one more quick question, because you talk about the role of prevention, and before Professor Billari and Professor Crimmins highlight the role of education. How from this perspective, we need to work in Italy to improve prevention through education?
Well, I'm not discovering anything and say anything new, but poverty and education are the main forces for a healthy aging society. So we have to tackle poverty on one side, and poverty and social attainment are strictly related to education. So education is a driving force for making people mind, consciousness, aware about what they have to do, and everybody have to do. So I think this is a good point, because the consequence of education is equality, or on the other side, inequality. In order to, you know, go through the border of inequalities, we have to increase education. And unfortunately, this country, Italy, is finding like simple solution. So please don't misunderstand what I'm saying, but through telematic university, we are not increasing the number of people with a degree. We are only increase the number of degrees, but people will maintain the ignorance as before. So this is not the way. Education means something very serious, and I think this country needs to be more serious than I think it's going to be.
Thank you, Professor Padovani. And Mr. Klee, Professor Di Luca and Professor Padovani talk a lot about collaboration. And how, in your perspective, you talk even about collaboration with stakeholders, but how a key player in brain health, such as Lundbeck, can work to improve brain health research and prevention in brain health?
Yeah, so first and foremost, I think it's absolutely true. We are just part of the puzzle as an industry. I think without collaboration between academia, that is fundamentally about ground research, we will not as a company or be able to, if we are not able to invest in that at an early point in time and absorb those technologies on the the new insights from a very early point in time, and also with the innovative technologies that we have, if we combine them, that enables the research to be groundbreaking in a sense. But also, as mentioned before, we need to work with academia around the world. I think the most essential part of this is that this is a societal element that we need to understand how to bring in also into research. So there are many disciplines of the research that we need, not only medical research, we need to bring many different disciplines into this to truly understand how we can eventually improve brain health.
Thanks, Mr. Klee. And please stay with us. Thanks. Thanks, Professor Di Luca. Thanks, Professor Padovani. And I invite you to join here. No, Mr. Klee, please stay with us. And I'd like to invite here Nicola Palmarini, Claudio Bassetti, and Morten Lorentzen for the last roundtable. And it was amazing because at the beginning, Professor Billari highlights the inequalities. Welcome. Hi. Benvenuto. Benvenuto. Professor Billari highlights the inequalities through Italy's, and even Professor Padovani talked a lot about inequalities. And so I'm glad to hear with us Nicola Palmarini, who is the director of UK National Innovation Centre for Aging in Newcastle, because he worked a lot about on inequalities of health. And so how we can work to solve these inequalities, and how we can work to, to shape a new vision for a republic of longevity.
Yes, can you hear me? So before going there, some thank you to many people here, because I think I'm part of the scientific board of this week, so I think it's so important to remind some people. First of all, it's Viviana Kazam. We're here because of her. Yeah. I think it's important to say that the incredible work that everyone at Brain Silk has done, I think making Milano a capital of longevity today, I think it's so important. This morning with Monica, we're discussing about becoming the capital of brain capital. Why not? All the support from many of you. I am very proud. I take the merit to have Professor John Wong with us today. I was contacting him almost a year ago, John. And it's such an incredible thing to have him here because of the amazing work that they're doing in Singapore, and I'll go through it in a second. And obviously Lundbeck, so longevity, the many people that are working in the background to make all this thing happen, which is important. The longevity weeks are flourishing globally. I remember 8-9 years ago, the first one I attended was in London. But I think it's so important that we're stating this thing is happening. And it's happening in a systematic way in different countries. I guess we are all realizing there is something happening besides the numbers and besides I would say, the core elements that it simply allow us to go around in our city and see how the cities are changing, how we are changing. I think it's important that, first of all, we start stating the fact that it's not them getting older, it's us getting older, which I think it's so important to remind, because then we can understand what are the drivers that stands behind what is changing in terms of society, which I think it's my point. I guess we keep on trying to solve the issues in a very traditional way. This is literally epoch changing. We're just putting a lot of energy in, for example, try to tackle the effect of climate change, which I always try to remember everybody. We care about climate change because we have a brain. Do we want to have birds flying, sun rising, clean waters? Who can take advantage of it, if not us, through our brain? Because otherwise you won't experience it. So we can go to Mars and leave everything here, but then it will be always the same human going to Mars. And again, it's how we interface ourselves with society, which I think is crucial. That's why brain capital is important. And that's why you can't have a brain capital and a brain health if you don't have also a physical health. Again, we need to work consistently in a systematic way, which leads to my point about what are the things that influence healthy longevity. We know there are mainly defined domains, then there are many scientists here. We could fight for the next 3 years defining what are the slices of a pie that define the health of a population. But roughly, and please don't kill me if I go this way quite sharply, more or less 11% is the, let me say, medical care, 7% yet is the environment, and I say 7 environment because environment obviously has an influence on us, but we still don't have the data that firmly could say that if you breathe bad hair, and Milano doesn't have a good hair, but there's a lot of people aging in this city anyway in a quite good way. So again, we know that bad hair could affect our trajectory of longevity, as for example microplastic. We still don't have the data, so let's stay with a small number. Then we have roughly 22 genetics, and then you have 36 and 24, where 36 is behavioral factors and 24 are societal factors. Again, these numbers are literally debatable, but more or less the slice of the pie are these. Hence, what we try to say, that 60% is behavioral and societal, meaning that there are factors, there's nothing to deal with medical care. And thanks God that there is medical care. So medical care helps us to somehow solve the problems that ourselves as humans are creating. So obviously we need that industry, we need that research. But on the other hand, we needed to design a different society. I think we have seen an example of what is happening in Singapore, meaning that there is a country, roughly 6 million people, that could resemble in terms of numbers, I think, Denmark in Europe, and in terms of population concentration, could be like Malta. I just checked the data this morning. That is showing that you have a political engagement. If you have a political drive, then you can design policies that then can generate healthy longevity, starting from the core principles, tackling inequalities that are related to societal factors and behavioral factors. There are 31 years of different life experience in Chicago between two different neighbors. It's 11 years of different life expectancy between Tower Hamlet and Chelsea in London. In Tower Hamlet and Chelsea, they touch each other. So there is literally a piece of the two different blocks, neighborhoods, that touches others. Meaning that these things is happening. One side, you cross the street and you literally are in a neighborhood that live 6 years more than the others. How this thing is happening? It's happening because we're still focusing most of our energies in solving the problem how we know to do it, but not trying to solve the problem at the source. Now, again, Singapore is guiding us to understand that if you have a political commitment, and in that country it's possible, you then can design policies that can literally drive the change in the population. We're at the Triennale. This is an amazing cultural institution of our country in which a lot of innovations has happened. Triennale this year, every 6 years there is a Triennale, Tokyo, Paris, Milano. Now this year is the 24th, is in Milano. It will open on the May 13th. The topic of the Triennale this year is inequalities. And I am the co-curator together with the great Marco Sammicheli of an exhibition dedicated to longevity. So President Stefano Boeri asked us, okay, what do you think are the core elements so that we can explain what longevity somehow is and how we can find ways to tackle inequalities. And we went back to the core point. What is longevity? And longevity is res publica. Now, if you think about the Latin words, res has two components. One is res, means a thing. So it's tangible because it's your health, it's how you feel, is how you wake up in the morning, is how you look yourself in the mirror, are the things you do, the things you buy. It's very tangible, and it's public because it affects all of us. Because there is one thing which is cross-cutting all of us, which is time, which is given to us in the same way everywhere we live, 24 hours. It's the way we use the time, or we are allowed to use the time, which is different. So if you follow this idea, we're thinking, okay, what it's missing? I think we are at the edge of a core changing in this society. We can't keep on doing the things as we did before. Yes, we have to create shareable data, we have to create a common system, we have to combine the different disciplines. But probably we have to step back and go to one core element, which is creating something which is missing. A completely different concept on how we approach the demographic change that Professor Billari explains so well for Italy and the global trends before us. So we invented an idea of what was missing. We literally took the responsibility. Instead of saying, oh yes, we should have to work together, we said, okay, why don't we create a state which is not there? The state that we think every state should have to, let me say, start thinking about. It's, as we defined it, the Respublica, so the Republic of Longevity, which has a motto that it's not by chance challenging the US motto today, which is in health, equality, we trust. And we envision how to design this state. So on the 13th of May here, you will see how we have framed 5 ministries of the many. I work in the UK. If you remember, almost 7 years ago, UK launched a ministry. In Italia would be said, senza portafoglio, without a budget, ministry for loneliness. And if you remember, there was another ministry in UK that created literally a movement. It was the Ministry of Sound. So UK people are quite good in creating ministries or political institutions. So we were thinking, why not? Why not the same? So we have created a Ministry of Purpose. We have created a Ministry of Sleep Equality. We have created a Ministry of Food Democracy. We have created a Ministry of Staying Together. We have created a ministry to challenge the idea of staying active. Why we did that? Because we wanted to literally kind of provoke a discussion that goes beyond the way we are thinking how a state should shape, for example, longevity, which is typical in the Ministry of Healthcare. Why so? We need every ministry to think about longevity, because if you work in transportation, it matters longevity. Education, we said it, it matters longevity. Cultural heritage, it matters longevity. We need someone that help us coordinate these connections that then empower the brain capital that we all want to achieve today. So the idea is just provoking a kind of a discussion. And we went literally deep because we also create all the secretaries, all the offices, all the agencies. So there is an agency for looking outside of the windows, literally. An agency for the open-mindedness, for challenging the things how designed. It's utopistic? I think it's not, and let me tell you why. This is part of an initiative that's led us to create a new framework for cities. We started almost 3 years ago. It's called the City of Longevity. And I don't know if you know that there is one assessor in a city in Italy, which is an assessor of longevity. And it came out from the discussion we had at that time. The city is Bergamo, the assessor is Marcella Messina. And the city of Bergamo decided to take a kind of a coordination role because they understood that what it was originally, the assessor or counselor, at classical social demographic, let me say, and support and impact and accessibility. So that kind of assessorship realized that they need a person on top that could coordinate the different sources, the different budgets, the different data, and the different agencies to promote longevity towards the city and the neighborhood. So we think it's possible, because if we start pushing forward that direction, probably we will have a ministry for longevity, or maybe a ministry of purpose inside the Ministry of Longevity, which sits in each of the other ministries, knowing how much, for example, purpose is important, relevant. So what I do is just, since I am hosted here in Triennale, and I am owning a little bit of Triennale by May the 13th, sorry, I invite you all to come. To debate, to discuss. We use obviously the language of design. This is a heritage of design and architecture, to discuss how the things around could somehow empower those domains that are probably the 5 core domains that could help us to influence the life of people, and try to give it a sort of a meaning, a physical meaning that we hope everybody can understand, and we hope that everybody could be aware of. Because there is one core thing lacking, is the understanding of the principle of longevity beyond a good idea of living healthier for longer. So what are the drivers, and what are the things that influence these drivers is the purpose of this exhibition.
Thank you, Mr. Barbarini. Very, very interesting. But You explain us the role and the value of these new policies, but in the first part of the afternoon we discussed here about artificial intelligence, and of course the width of health data is increasing a lot. I believe actually there are 2.3 trillions of billions of health data, and they are growing. But do you think that in the upcoming future, to preserve and promote lifespan and health span and brain health, we will work on health policies or eventually or meta policies, rule and algorithms?
I think we need, first of all, to work on understanding the ecosystem. Let me explain. I think it was 2016, I was with Joe Coughlin at the MIT Age Lab. We did a fantastic panel about, I would say, AI, machine learning with people over 90. And at that time, there was the first autonomous vehicle out there, okay? And what came out so loudly is that the very early Teslas were around, the idea that mobility could be empowered by, self-driving machines. And it came in so clearly. First question to people over 90: would you trust a car driven by a computer? Yes, everyone. We trust them much more than humans. Second, would you like to have a self-driving vehicle? Yes, I would, because then I don't have to ask my daughter to pick me up and drive me to the grocery store and drive me back. So it's the autonomous power of this innovation. What I'm trying to say is that sometimes, again, we still don't know or are not able to translate properly how this innovation matters to longevity from a broad perspective, but also can empower the commercial side of it, so that a Tesla, that we can debate. I know there's a lot of political things related to Tesla. Let's talk about a Peugeot or whatever else. But I'm saying that can help you from a far different perspective of what you thought that product has been designed. And those technologies are at the core of our future, meaning that now, finally, if we can debate about more properly about the slice of the pie I was trying to discuss before, if environmental factors or behavioral factors are somehow affecting or not, and how our longevity trajectory, it's just because now we have the data, we have the techniques of machine learning that help us to understand this data, and we have computing capacity that we didn't have before. I think it's in the last 5 years that our computers are now able to process this data, and I think with quantum we have no idea if we'll empower yet a proper way of analyzing the data the way we think, but there is a big hope that we can process even more data. So that, coming back to your point, I think it's through that type of knowledge that we will be able to finally see the connection of what it's technically called the exposome, on how we can understand what are the right trajectories, so to become to very personalized intervention that will matter myself and not everybody, because each one of us in this room age in a different way, right?
Thank you very much. And we hope even that this personalized intervention should help even to reduce inequalities. But talking about a lot about policies, we have the pleasure to have with us even Professor Bassetti, and it was introduced before by even Professor Di Luca, and Professor Bassetti actually is the Vice President of the European Brain Council, but he even is the Dean of the Faculty of Medicine Department of Neurology of the University of Bern. So, Professor Bassetti, a couple of key points, because we talk a lot of policies, and you're working a lot on policies from a European perspective, but even in Switzerland, where you develop a very, very interesting brain plan. Can you explain us?
Yes. First of all, thank you for the invitation. Thank you to the organizers and to Brain Circle, and I join all the other speakers in thanking Viviana Kazam. If I'm here, it's because of her. So, I mean, I really have a very warm remembering of her efforts to bring us and bring me here. So let's join me to clap for her. You know, I have been involved for years now with Monica, Alessandro, Matilde in developing a European reasoning about, you know, the priority of brain disorders and the need of promoting brain health. But eventually you have to boil down to practical measures in the reality you work, and that's probably the most challenging part. It's difficult to talk about determinants, the need of data science, etc., etc. But it's even more challenging then to transform this knowledge and maybe this agreement among experts into concrete actions. So today we'll be trying, I actually, as you see in this slide, I have different hats, so I'm working at different levels, but today I will just come down to the very simple and very pragmatic level of a Swiss neuroscientist that is trying bottom-up to convince the policymakers that brain health is a priority. So I will try to show you the journey that we started. And maybe one thing I would like to say is that obviously there is no one size fits all. So this is just what we try to do in Switzerland. And eventually, if you want to realize something at local level, you need to understand the frame in which you work, the needs, the gaps, and also the psychology of the people, which obviously in deep Switzerland is not what you find in Milano. And I'm very happy to be here because I'm Italophonic, but you need to understand really who you're dealing with. So let's move to the slides. So I actually structured my presentation in 3 points. What is the problem? And please excuse me if I will repeat something which has been said before. I just joined a couple hours ago. Then what I see as a chance, and I will be very brief, and then our approach. So what is the problem? Well, we have a problem related to brain disorders. The mortality, the disability, the costs, and I would like to also add, which is part of what makes my life as a neuroscientist and neuroclinician so interesting, is to deal with the sufferance of patients and families with brain disorders. And finally, the stigma, which are really quite tremendous in the field of brain disorders. Think about depression, think about dementia, think about epilepsy. So these are the figures that have been mentioned before. This is a cartoon that summarizes the current evidence, and these are published data, so it's not my cartoon. And as it was mentioned, if you put together neurological and psychiatric disorders, you end up with 20% of the entire burden. This is just related to the frequency of the disorders, but if you look at disability as another measure of the burden, it happens that both disorders are also the leading cause. And if you look at the costs, well, these are old data, but are new data that I will show in a moment. Brain disorders are the cause of cost which exceeds the sum of cancer, diabetes, and cardiovascular disorders. Now, if you look into public health strategies at hospital, at national, at European level, you don't talk about brain disorder. You didn't talk until recently. There is a lack of awareness which leads us to be here today and talk about these things. Now, these are Swiss data, and I am pretty sure that this is probably the same for Italy and other European countries. We look here at one measure of the burden of brain disorder, that is disability. How many years of good life do you lose because of a disorder? And you look here at 3 columns in 1990 and then 2019, cardiovascular diseases, neoplasm, cancer, and then brain disorders, and you see actually 2 things. You see that we are good in preventing cardiovascular diseases. We all know what we can do in terms of diet, et cetera, and smoking and hypertension. And this is why the disability related, these are the red columns, to cardiovascular diseases are going down. They are not eliminated. So we still need to do something, but we have shown that prevention is helpful. If you look, however, at brain disorders, brain condition, the burden is increasing. So we have something to do. We looked at the Swiss data just to make sure, and first of all, whether the European data fit with Switzerland, but also because politicians believe only in, if they do, they believe in data and they believe in numbers. And we want to actually walk the talk and providing local data to convince them what is the base of what could be the policy. And these are recent data from Switzerland, and not surprisingly, because this is what we have been saying on different occasions from a European and also North American standpoint. Brain disorders, taken together, neurology and psychiatry, are the #1 cause of disability in Switzerland in 2021, accounting for 1/4 of the entire burden of diseases. Now, if you look at the costs, this is going from 2000 till 2019. Again, the increasing costs in Switzerland, these are direct costs. I'm not talking about indirect costs. They are also there. and not surprisingly, brain disorder #1 of costs in Switzerland for the health systems, just replicating what we have been seeing in Europe. By the way, interesting enough, dementia, headache, anxiety, depression are those that contribute the most, and now you can start wondering why. Well, some of them are devastating, but some of them may not be so disabling or so, how should I say, impacting on the cost per year, but they are there for decades. You know, migraine starts in the adolescence, and depression may start also in young age. So there is a combination of the single weight of a single disease and then the duration of a disorder, and this explains. By the way, sleep is not appearing anywhere, and I'll come back to this. You mentioned about the sleep, minister, and you also mentioned something about sleep. And this is actually the very recent data, and Matilde, who is in the board with me of the EAN, has been putting an effort on estimating the cost of neurological disorder. Now I boil down to neurological, so not brain as a total, but neurological disorders, so half of the problem, if you want. And these are the estimated costs of 18 neurological disease groups, headaches, stroke, dementia, etc. And if you then boil down the different contributions of the different disease groups, not surprisingly, because they are very common, headache and sleep disorders are the driving force of the estimated cost in Europe. So this was the problem. What is the chance? Well, it was said very eloquently by the previous speakers. First of all, the incredible advances in our understanding of the brain. And I join you because I think we have to acknowledge the fact that we understand much more about the brain, about the mechanisms of brain disorder than we used to do 20 years ago. And if you look into the health policies of most countries, and I went into the policy of my country, the brain does not exist. It is mentioned somewhere, but it is not taking into account the fact that the brain is there and we understand it. It's sometimes a black box. You assume things, maybe sometimes you find something about mental health, but in the textbooks of, in the German language about prevention and public health, the brain does not exist. But the brain exists and we understand the brain. So we need to take into the scene the fact that we understand the brain. Obviously, we do not understand everything, but we understand much more than 20 years ago. And the second key message, since we start understanding the brain and the brain mechanism, we understand how to prevent brain disorders. So these are the positive messages. So this is a slide that I do not bring specifically to this audience, but I mean, the advances have been phenomenal. We start having causal treatment. We understand the mechanism of neuromuscular diseases and we can intervene into the mechanisms, so-called individual or causal treatment. We start having treatment for Alzheimer's disease. We have also non-pharmacological approaches and we can influence by different stimulation paradigms brain function and therefore the course of psychiatric and neurological disorders. And actually, this is a novelty from Lausanne. We can actually modulate the spinal cord function and bring spinal cord injured patients to walk again. So this is just, and there are many, many other examples. So we need to understand when we talk about brain health and brain disorders and what we can do, that the advances have been phenomenal. Now, it was mentioned before, there are many things that we can do for One Health. Everything that is shown here is actually eventually good for the entire individuum. If you eat correctly, social activity, physical and mental activity, sleep, but the cartoon of the influence of the factors that can contribute to a healthy brain is very complex, but we understand a lot. Some of them are still somewhat theoretical, some of them have been proven. And I like to say that there are a few things that the individual can make. This is the preserve part, and you have something that relates to risk factor, the protect and prevent. You see, by the way, that we have also the social media there somewhere, and then eventually something that the society should do, so the so-called plan. It is obvious that it's difficult to talk about brain and mental health in the Ukraine today, since they have other issues to solve. But we have a lot of targets, and we need to invest. And I joined Monica Di Luca in shouting loud, we need to invest in research, because I could say, yes, we understand a lot, but we understand a lot not. And so we need really to invest in research to have a mechanistic and causal approach to prevention and disease. And in fact, the results of our advances in brain research is that today, it's obviously an estimation, it's not proven by a single study. It is estimated that up to 50% of the phenomenon dementia may be prevented, maybe more the vascular than the neurodegenerative. And the same actually for stroke, and actually the estimation goes up to 50 to 80%. This is a little bit theoretical because you cannot actually target all the risk factors, besides the fact that some of them are inherited, so you cannot choose your parents. Well, you can adopt parents, but you cannot choose your original parents. So what is the approach? And here I like to use two words. It's about plans, but it's about, and it was reiterated by partnership, we need to exit the silos. I mean, it's easy to be in a silo. I mean, everybody likes to be in a silo. But to really make a change, we need to exit these silos and create partnerships. So the WHO has actually recognized mental and neurological health as a priority and developed different plans in 2013, 17, 22. I believe the WHO and we should try to have a more holistic, and you say intersectoral approach, and combine these different plans. And I would like to mention that different nations have started to declinate, these challenges at national level. Norway, Sweden. Norway was the first one. The Scandinavian are often in these fields very innovative. Switzerland, Germany, Italy. And Emanuele Di Luca mentioned also this very important decision at EU level to have this strategic research and innovation agenda, which boils down then to concrete finances of projects and policies around brain health in Europe. So this is then the background in which we started the Swiss Brain Health Plan. The call for action was in 2022, and then the main effort was really at the beginning to put together all these scientists. This has been probably the most difficult question. And some people say, how did you do? Because you have neurologists, neurosurgeons, you have psychiatrists, you have public health people, you have GPs, you have neuroscientists. Well, this is really the challenge, and when we will have a drink later, I will tell you a few details about this difficult journey. These are the priorities, which are essentially always pretty much the same: awareness, training of new professionals. I think this was mentioned before. If we want to promote health and brain health, we need to have a different approach to education. We have to have new workforce that actually work to prevent brain health at the GP levels, at the level of the society. We cannot wait patients to come to the neuro centers or to the specialists. We need to promote research on determinants, but also on brain health. We have to join forces to promote campaigns to prevent, and last but not least, listen to patients, and you use the word voices of the patients and actually caregivers. Sometimes, and I have just a couple more slides, I'm asked, so but what is different from the Finnish, what is different from the Italian, what is different from the others? Maybe not so much, but I identify 4 specificities which may not be completely specific. The first one is that we see neurological and psychiatric disorders at 2 sides of the coin, and there are hundreds of reasons to do that. This is not new, it's known since Griesinger, who actually in Zurich started saying that psychiatric disorders should have a biological base, should be seen as brain disorders. And we need to have an intersectoral. That means all the stakeholders should join. And I will not talk much about longevity, but it's obvious from the talk. If you want to promote brain health, you have to start in utero. You have to start in the first days of life. As pediatricians say, the first 1,000 days are the crucial. I don't know if it's 900 or 5,000, but it is clear that this is a crucial moment. So we need to join also with experts in this field, including pediatric specialists. The second one is that I abandoned in Switzerland, we have abandoned the idea of putting the brain in the center of the effort. This is not the way to go. We need to be seen as a partner. It's a one health approach. We don't have a health of the foot. We don't have a health of a lung. As much as we think that the brain is the center, the culmination of, but we need to be seen as partner and not those that come into the field and try to take it over. So we need to synergize with activities that are already taking place, and this needs also the modesty of being the last coming to the table and trying to create opportunities for the other. So it's not about saying what is different to what you do, but what we have in common and what is the goal we can share. And it's very difficult to differentiate between prevention and early intervention. So I think we need to think about also detection interventions. This is one specificity in Switzerland. And we believe that even the brain damaged patients has to take care of brain health. So I think it's very important to talk also to patients that have already a problem about the potentials of brain health. The third is that if you want to do something and to make a change, you have to create synergies. And it's also about the single voice, was said before. And the SFCNS is a federation of neurosocieties. I was actually launching this initiative 18 years ago. And it was the idea of having one voice in Switzerland when it comes to the brain. But then it's not sufficient. You need to have GPs, you have to have economists, we are not the expert on how to run public health. The public health people, when you approach them, they need to understand you and you need to have their alliance. You cannot do this by yourself. And finally, you have to identify who are the people that decide about prevention in the country, and we have three forces and we need to work with them. I'm coming slowly to the end. What did we do? Awareness campaigns. We have started probably the first brain health course, university course in Europe, and we have started playing with the kids about brain health in schools. This is something that we have learned from the EAN in Austria and Finland, so we started in Basel. We have started different works on costs in Switzerland. There are huge research initiatives in Switzerland that are launched, and we are joining them, the NCCR projects. And we have 3 national prevention campaigns on migraine, sleep, and dementia. And we work with patients. I will not go into the details. I think to have a national campaign, you need to have flagships in different areas. These are the patients. We have the world ski champion that actually had head trauma, was in coma, and is a great voice for us because he profited of rehabilitation. We have depression. Belle Lee is the wife of a rector of the University of Bern who became demented, and she's now one of our voices, and she is not shy to say what she has been suffering with her husband about seeing this brilliant infectiologist becoming demented within a few years. This is the course, which is actually virtual, and it's open to different health professionals. It's not only for doctors, nurses, sports scientists, psychologists, 37 students from the world. This is our health minister. We hope to get the mandate, Ms. Baumschneider, and I would like to invite you all, and some of you are already invited, to come to this international workshop on brain plants. It's about learning from each other and actually not repeat the same mistakes all over the place. Thank you for your attention.
Thank you, Professor Bassetti. Thank you. Only one more question, because you describe us the amazing evolution in the last 2 decades. But which are your dreams, your expectations for 2050 for brain health?
My expectation is to be there.
Thank you very much. So, and you talk even a lot about working together, about the role of the patient. So I'm really pleased even to introduce Morten Lorentzen from the Danish Brain Injury Association and Vice President and co-founder of the Danish Brain Council, because he worked a lot to create a common voice, a common approach, and even in including the voice of the patient to explain the value of the brain health.
Yes, and many thanks for inviting me. It's been a real pleasure being here a few days and collaborating with such a great bunch of people and organizers. And it's really a pleasure. But let's talk about what we're doing in Denmark and we're trying to do in Denmark. And I would like to paraphrase the great Albert Einstein, who presumably said that if you continue to do what you have always done and expect new results, you're a moron, more or less. And I agree. And there is a tendency that within the neuro field that we're very siloed, we are fragmented, and we're not really capable of, might meet together, but not really work together. And when we looked at how Denmark was doing, basically those 3 disease areas that is perceived as the most important, and I'm sure that covers other countries in Europe as well. It's cancer, it's cardiovascular diseases, and it's diabetes. So if you ask you ask politicians, you ask journalists, you ask the people in general, these are the 3 most important diseases that we have. Now, it's not going to be a fight between diseases, this one, but we really need to put the brain on the right shelf. We really need to get together, get rid of the silos, and work together in order to have the most important organ we have and put it on the right shelf. And this is basically, and also this is what the pictures show. You could say that the birds are crying not so loud in the forest. They have small cries about each and every fragmented part of the community that they work with. That's not what we want. We want to be the great roaring lion on the savannah. That's what we need to be. And we can only be that if we work together. So 6 months ago, we created the Danish Brain Council. And it is difficult, like you say. It's not easy to get such an intelligent bunch of people together. But we even expanded it because we also invited the patient organizations. We invited the professional societies. We invited the research environment. We invited the treatment centers all together to join forces in order to become one strong voice, or the lion roaring on the savannah. I can happily say that we are now 33 organizations that's joined. We have a potential of about 75 organizations, so we still got a long way to go. But in half a year, 33 organizations showed us that there is a need, there is a will, and there is a plan. Now, I just took this one because one of the most important things, and Claudio touched upon it, is in order to be able to get to what I call the political domain, and the public domain, and the media domain, and the researchers domain, and the health system domain, we need to be able to produce numbers. It's the common denominator that they can see what the numbers are. And luckily, scientists and researchers from the University of Aarhus, with the help of Lundbeck, did a thorough investigation into what is the burden of brain disorders, and that includes both the neurological disorders and mental disorders. What is the burden? And in general, first and foremost, 35% of Danes have some kind of neurological or mental or brain disorders. 35%, 2.1 million people. That's a lot. The direct burden is about 1/4 of the total health cost. The indirect burden, which of course include all what we have because of we're ill, is giving us 33 billion euros, which if you add those two numbers together, that's about 8% of the GDP. 8% of the GDP in Denmark. Now, when we look at those 25 diseases that we looked at, and this is very small, I'm sorry about this, but depression is by far the biggest cost on the direct burden, and it's also the biggest cost on the indirect burden. Now, why am I emphasizing this? I am because prevention could actually make that 1/3 less. Scientists believe that 30% of depression can be prevented. Now, what kind of impact would that have on the numbers? The next one is sleep disorders. We talked briefly about it. Not many people mention sleep disorder as being a brain disorder, but it is. And it has massive effect into the economy, both direct and indirect. Dementia, it has a huge effect on the direct cost, but not much on the indirect, because as we all know, it comes late in life and you're really not associated with the workforce anymore. But again, 50% of dementia can be prevented. Huge impact. Now, this is not a question about us using less money on the brain disorders, but to be using it smarter and be focusing more on prevention. The Danish Brain Council, being relatively new as we are working closely with other friends in the European Brain Council to develop a brain plan like we have in Switzerland. And just last week, we met in Brussels together with a member of the European Parliament to discuss development of brain plans around it. That was really, really a great get-together in order to share and also to determine what not to do and what to avoid in order to be able to move fast forward. Because I do believe that we need to move fast forward. And I also do believe that there is no health without brain health.
So, thank you very much, Mr. Mortensen. And I'd like even to hear from you and even from Mr. Klee. So, what are the next steps to put the brain health on the right shelf?
Okay, in Denmark for us, the big step actually is to convince the politicians that they need to change the focus. They need to be looking at the brain as a very, very important piece of action. They need to do something about this, and we will help them. We will create a brain plan that will assist them making the right decision. And we've already started one-on-one with the politicians we have in the Danish Parliament. And importantly enough is, because we have such a great numbers report on the burden, they are actually waking up. They can see that they've probably been misled for some centuries. So I really think that's the most important thing. Then we have to start with education. We have to start with the general public. We need to make information campaigns, and there's a lot of things to do, but the politicians is the most important.
Thank you. Thank you very much. And Mr. Klee, on your side, how we can help the politician to understand this vision better?
I totally agree with what has just been presented. Data speaks for themselves, and we have to remember politicians make choices based on economy, but they also make choices based on voters. And we have to remember how big a proportion this touches, not only directly, but also indirectly. And that is, for me, and I think for all my colleagues here, is that it's a no-brainer not to do it.
Thank you. Thank you very much. It was really an amazing session with outstanding speakers. I think that today we build a lot of bridges, as Monica Di Luca said, because we take a lot of point of view from Singapore from UK, from Switzerland, from different even experiences. And so I'd love to ask to Tiziana Mele, General Manager for Lundbeck Italy, to join us here, because she's one of the best bridge maker I ever known. And she shaped this session even to help us to understand the value of the brain for the future of lifespan and health span.
Thank you, Ludovico, and thank you to our speakers, because it has been fantastic 2 hours together. And I tried just to remark some of the words and some of the lessons that I learned today, starting from Professor Wang, and to the warning of add life to years, not years to life. I really appreciate your presentation and the Singapore experience, also because Professor Padovani knows very well my interest in building also specific golden, not silver, cities to host the future challenge of aging population. Then Professor Di Luca, the complexity that demand us a unified approach, not only innovation. Innovation is key, but we need also to have a unified approach, absolutely. Then Professor Padovani, one of the things, because it's something that really we shared, putting together psychiatry and neurologist. Many of you that knows very Lundbeck so well, and Ludovico also, because you were part of this effort, knows that for us, mental and brain are part of the same challenge. And you have on your chair this booklet that was, maybe Professor Padovani don't mind, but we started before Neurological Society, putting together psychiatrists, neurologists, pharmacologists, and this is the result that we all together have done. Professor Palmarini, in health equality we trust, absolutely, but we need together to act in order to make it a reality. And we want to have part in this action. And great presentation, Professor Bassetti, presenting the problem, the chance that we have, but also the approach. And again, it's not one single actor, but it's an holistic approach that we need to act. And then, last but not least, because even if I'm Italian, but by heart I'm Danish because of Lundbeck, and being a roaring lion in the savannah. I am from the south of Italy, so I really appreciate that a Dane can say a roaring lion in the savannah. Just we need to make brain as a roaring lion in the savannah. So maybe I will push Professor Padovani with all the scene to have this fantastic image, to have a brain on the right shelf. And then last but not least, a great thank to Viviana Kazam, because when we discussed about this roundtable, I said to her, how we can have a so cross-countries panel, and she told me, Tiziana, you need to trust, and we will make it. So thanks, Viviana, for making it happen. And thanks also to the current president of Brain Circle, because she supported, it is Marilena Citelli, that has supported us also during this journey. So this is my last words, so enjoy the rest of the day.
Thank you. Thank you very much, Tiziana. And let me say at the end one more thing. All the speakers help us to understand that as the Pope said, this is not of an era of changes, but a change of era. So we need a new way to shape policies and to shape a new vision for brain health and life health. Thank you very much.